Showing some TLC to your HEART. Smarter Heart University and Dr. Scott on AM 970, The Apple.
Welcome back. Final stretch, home turn, heading down the final turn here on your Smarter Heart University. So the answer to the pop quiz about a Mediterranean diet using olive oil as its fat source and more fish and more poultry versus a traditional Western diet with 32% more of the animal fat reduces recurrent heart disease in 30, 40, or 50%. Well, the Mediterranean diet lowers recurrent heart disease, and it's in the form of heart attacks and unstable angina, stroke and heart failure, pulmonary embolism, as well as hospitalization, all of that by 50%. So right on the money on that one. Hey, what can you do about this? What can we do? That's our final section as always. So hopefully everybody out there, what you've learned today is that dietary supplementation with the omega-3 fatty acids or with fish decreases your cardiovascular death, non-fatal heart events, and dying from any cause. And the higher the risk you have, as we said before, the more you benefit. So if you've got problems already, fish oil can help even more. It gives you additional benefits when it's included in the Mediterranean diet, as I just stated, but the optimal dose is unclear. 1,000 milligrams a day. This is American Heart Association, not our journal of American College of Cardiology. 1,000 milligrams a day for heart patients and 500 milligrams a day for those who don't want to be heart patients. What about select groups? So here's a good take-home point. The following doses have been studied in select research. This alludes to what we said at the tail end of last segment. For high triglycerides, 200 to 499, about 1 to 4 grams a day. Greater than 500, 4 grams a day. For high triglycerides and LDL cholesterol together is statin plus 2 to 4 grams a day. So that's the standard recommendations that's been studied. For high blood pressure, 4 grams a day. For atrial fibrillation, the only real recommendation is not in capsule form. Those over 65 to prevent a stroke already on an aspirin or Coumadin. If you don't know about the CHAD score, tune into our atrial fib lecture that we did. We went through that. To prevent a stroke, baked or broiled fish 1 to 2 times a week is the recommendation. For asthma in kids, high doses, 17 to 27 milligrams per kilogram of EPA and 7 to 12 milligrams per kilogram of DHA daily to prevent spasm, exercise-induced, and all of that. For preventing arterial plaque and progression, hardening of the arteries, about 6 grams a day for about 3 months. This has been studied. Then 3 grams a day thereafter. And remember to check your LDL cholesterol if it's already elevated. For rheumatoid arthritis, 4 grams a day of EPA and 2 grams a day of DHA. Again, 6 grams total. Check your LDL cholesterol. Again, I want to make sure I hit that point. To prevent a miscarriage in women with something called the antiphospholipid syndrome, and don't worry, folks, we're going to do a radio show on that, about 1 to 2 grams a day. In addition to sometimes they're put on an aspirin. This is where antibodies are to platelets and it causes miscarriages. And finally, after bypass surgery, to keep the veins open, about 4 grams daily has been studied. Lastly, what about the fishes? The content of EPA and DHA in common fish is going to astound you. Real quick, because we're going to go over the most and the least. What do you think the number one least fish that has the least amount of EPA and DHA?
Swordfish.
Okay. Ready? Here's the least. Number 1, orange roughy only has 26 milligrams total. Number 2, tilapia has 115 milligrams. Mahi-mahi, 118. Cod, 134. Catfish, 150 to 200. Light chunk canned tuna, only 230. And yellowfin tuna, 237. Let's go with the most. Trout, 981. Mackerel, 1046. Sockeye salmon, 1046. Coho salmon, 1087. Pink salmon, 1094. Bluefin tuna, 1279. Atlantic salmon wild, 1564. And finally, the number 1, where's my David Letterman music? Atlantic salmon farmed, 1825. Okay, that's why it's so much. And don't forget the fish, folks, that have high methylmercury levels: the swordfish, the shark, the tilefish, and canned white tuna. Remember that in terms of that. Let's get a question.
Sure.
Carol from Toms River.
Good morning, doctors.
Good morning. You have a question?
I have a question. Can you get the same benefits from flaxseed?
No, Carol. Flaxseed may lower your LDL cholesterol a little bit, but flaxseed contains alpha-linoleic acid. And again, as we said, that's only converted to omega-3 fatty acids by about 5%.
Doctor, if you're taking flaxseed and fish oil, should you be doing both, or is
you
that
can
too
do
much?
both. Flaxseed is beneficial in digestion and elimination of waste. It is an essential nutrient. Dr. Stephen Sinatra, we talked about during our dietary lecture. If it looks good, don't eat it. It's one of the superfoods, if you will. Flaxseed's present in foods. It's a very good agent from an anti-inflammatory standpoint, but again, it's alpha, the omega-6 fatty acids that is not well converted in the human body, so that you really have to get it from diet.
Okay, great. Thanks.
Thanks, sir.
Thanks, Carl.
Have a good weekend.
Appreciate it. You too. What do you think?
Clearly,
good question, by the way.
Well, the benefits of fish oil, I think we've established that there's really a lot of benefits for it. The potential, as we always talk about, the potential downsides are minimal at best. And the question is, how much do you get, and how do you get it? A Mediterranean diet with 2 to 3 servings of fish that we just talked about in a week is a nice recommendation. We always get back to lifestyle. If you eat a bad diet and you live a bad life, you're going to have much more bad events or higher events than if you eat live a better lifestyle.
Eat to live or live to eat.
Right.
Right.
And then on top of that is the beneficial effects of the higher dosages that we're talking about. And again, we always get back to this, the quality of the agent that you're getting. You just go to anywhere and pick something off the shelf, turn it around, spin it around, take a look at it. Is it going to have mercury in it, or is it going to have the amount that is it, say, 1,000 on the front, and is it really only you're getting 300 on the back?
Well, that's what we hope, that we're going to have a roundtable forum in 2 weeks about anti-aging or complementary medicine. And we're going to have a couple of doctors in the studio with us, hopefully some call-ins. Hopefully it won't get ugly. But I think we're going to try to address this issue in a politically correct way of the benefits as well as the not so helpful.
Right, because you want to take something that's
we
going to benefit.
We want to provide,
and not spend your money on
in this economy. We got to be careful.
Yeah, and you got to be taking stuff that is. Everything that we do is, I always tell my patients, all the medications you take, they're all poisons. They're doing something to your body. So let's just make sure we're poisoning the body.
And that's what complementary. And listen, I have a fellowship in this. I have a certification. That's why I wanted to go out and learn this, in addition to the lipidology, and in addition to our board certification in cardiology and yours in peripheral vascular disease and in interventional cardiology and cardiac CAT scan imaging and all of those wonderful things that you do.
There's got to be more.
We got to bring to the table more of that. That's it for this week, students. Tune in next week, where we teach you the A, B, C, D, and E's of vitamins in the heart. What you don't know could cost you bucks at the store. We give special thanks in honor of Kim and Chad for a true blessing. Remember to register at www.smarterheartuniversity.com and join Facebook for daily updates. Those that are already members, stay tuned for a very special announcement. Remember, be well, friends, and get to it before it gets to you. Stay safe. Have a great week.